Hi, good morning. My name is Lucia Fernandez. I'm from Mexico. I'm part of the cohort 2022-2023 of this GLODERM mentorship program, and my mentor was Dr. Claire Fuller. So as a brief introduction, I would like to talk to you about the migrant situation in Mexico. Yearly, between 140,000 and 400,000 people enter Mexico to cross the United States and Canada. In past years, the inflow of migrants arriving at the north border of Mexico has increased dramatically. Nearly, we have seen a 60% increase from 2019 to 2020. Migrants mainly come from Guatemala, Honduras, and El Salvador. As you can see, the red dot is my city in the north part of Mexico. It's not in the border with Mexico, but we are like 2 hours away. So, and you can see in this map also the routes that migrants take. And actually, our city is part of their travel through the country to get to the US border. So this year, I've been working on Under the Radar Migrant Dermatology program. This program, what we like to do is to ensure access to care, provide early diagnosis, and prompt access to treatment. And the goal of this project is to promote skin health for everyone, regardless of their legal status. So this outreach, this program has two parts. One of them is the Migrant Dermatology Outreach Program, in which I would go to the migrant and homeless shelters and provide free dermatology consultations. And the other part is shelters referring patients to the university hospital, especially complex cases that need biopsy or inpatient treatment. And a very important part of this referral to the hospital is that we have to ensure migrants that the hospital is a safe and welcoming space. This is some pictures that I took one time that I have been on the shelters. And as you can see, patients that we have treated, mainly living in the shelters, they have common skin conditions, maybe seborrheic dermatitis, atopic dermatitis, melasma. However, patients that were referred to the hospital, we have seen really advanced cases. One of the most common conditions is cutaneous leishmaniasis, which is not so common in the north part of Mexico, so it has been a challenge to treat these patients. And the third patient, well, he has like very extensive psoriasis. Actually, those of the first two patients, patient 1 and 2, they had to be treated inpatient, as in an inpatient setting. So this has been really challenging to manage these complex cases. And well, this is what I like to call a bonus project. It's a teledermatology program. So through the mentorship program, I really developed an interest in teledermatology, hearing from my mentees and the other mentors. So we started this. There was a telemedicine program, but the teledermatology part was lacking. So I started working with them. So we provide free dermatology consultation to remote communities, that the people living in the state of Nuevo León, which where I live. And I work with primary care physicians and as they diagnose and treat different skin conditions. And when they're needed, patients are referred to university hospital through this program. The benefits of this program were definitely a prompt diagnosis and treatment, but also the education of primary care physicians has been really important. And well, this is some pictures. These are mainly skin cancer pictures, but of course we have seen common skin conditions. But for example, this year we diagnosed melanoma and was promptly treated, and squamous and basal cell carcinoma as well. And turning back to the Migrant Dermatology Program, next steps. This year I'm participating in the North American Refugee Health Conference with a workshop that's titled The Dermatologic Manifestations of Infectious Diseases in Migrants and Refugees. I'm working with Dr. Amir Mohareb, which is an infectious disease doctor that was introduced by Dr. Esther Freeman, so thank you so much. And I see this as an opportunity to increase the visibility of the migrant situation in Mexico, because in this conference, mainly people from United States and Canada attend, so it's an important part to increase the visibility of what's happening in the other side. And of course, I'm partnering with CeraVe Mexico. They're donating essential dermatologic products, and we're planning to do a dermatological bracket in July 2023. We plan for this to increase definitely timely access to dermatological expertise for the migrant community, and with the help of CeraVe to increase the visibility of the Migrant Health Project. And well, both projects, they're at an early stage, just started from zero. So in total, approximately 150 patients have been benefited with this project. Both projects offer the opportunity to educate primary care physicians, and the impact might be better than expected. We have some areas of improvement, which is to increase the visibility of the project, and I would love some interdisciplinary collaboration in the migrant health project. So thank you so much.